Welcome to Health for Life, your trusted source for health and wellness insights, proudly presented by Vitruvian Health, the comprehensive healthcare system serving Northwest Georgia and Southern Tennessee with leading entities like Hamilton Medical Center and Bradley Medical Center. We're dedicated to keeping our communities healthy and thriving.
Today we're talking with Dr. Natalie Bessom, a board-certified family medicine physician at Hamilton Primary Care in Dalton. Dr. Bessom, thank you for joining us today.
Thanks. Glad to be here.
So from what I've heard, the supplement industry is worth like a lot of money.
Oh, yeah. Somebody on TikTok is making a lot of money by telling you that. And I'm here to tell you, from a medical standpoint, there is not one quick fix for anything. So be so careful when you're investing money in this type of stuff. And, people on social media are not necessarily doctors. They're influencers and they're paid a lot of money to say certain things. So just be careful.
It's a big business.
It is, but it's under-regulated. The FDA does not regulate any supplements, so you have to be careful because they can really put anything in there and nobody's telling them yes or no or not to. Sometimes your money is going to pay for things that are absolutely nothing inside of those capsules. And just remember, natural doesn't mean safe. There's a lot of things that are natural and in our environment that are definitely not safe things. So supplements go the same.
I mean, getting into like very specific things that are like involved in these, what about like collagen? What is that safe?
That's been a big one on TikTok, I think. I feel like in the last year that's really blown up. There's some very, very limited data on that. It's probably less than 1,000 people total that have been in the population for studying the collagen. There is mild evidence that it could boost muscle mass, but from my perspective in the studies that I've looked at with this supplement, it's more because collagen is made from animal products, so there's protein in it. And, if you're a bodybuilder, if you want to build muscle, you know that sometimes protein is the root part of your diet that you would want to boost to increase the muscle mass. But that also goes with exercise. So you have to be building muscle to do exercise to build up the muscle mass. You can't just take collagen and let it work for you. But anything to do with joint safety or skin, nails, that all is not to be proven. Your body makes collagen. And my favorite example for this one and a lot of other supplements is if you just ate sunscreen, would it go on your skin and protect you? No, it wouldn't. So your body is very adept at making certain things in a way that it can use, but just because you put it in your body doesn't know how to use it in that way.
That's a really good analogy. It makes perfect sense to where you can't just consume things and have it just work all of a sudden.
Yes. And I mean, when we're talking about healthy diet, that is a whole nother issue because plants and the way that those are designed, they do help you in a whole aspect of different foods, varieties, colors. They all have different benefits and properties. But when you're talking about something that was made in a lab, that is totally a different discussion.
Another big thing that, I've seen for years and years and years is like vitamins. They have different vitamins. There's so many different types. Are there specific ones that are just like not really what they say they are?
Yes. I've seen this a lot in my practice lately. I think certainly since COVID, it was advised people take, zinc, vitamin D, vitamin C, these things that would help you ward off common colds and diseases, things like COVID. But now, years later, people are still taking them. And one of the biggest complaints I've heard in the last couple years is hair loss, hair thinning, general fatigue, body aches and things. And here we're checking their levels of vitamins and they're actually overdosing on vitamins now. So you can overdose on supplements. They all have to be metabolized somewhere in the body. So sometimes that means the liver, sometimes that means the kidneys, and sometimes that means depositing the excess in your hair, your nails, parts of your body that's going to be shed eventually. So it's kind of like decomposing the toxins. So be so careful, especially with vitamins A, D, E, and K. Those are fat soluble. And so that means your body holds on to them. They don't just excrete them. And those can actually go into overdose levels if you take too much.
I feel like that's why it's like when I was a kid, those like little gummy vitamins were so popular. And they always tell you to like take one a day, but they make them delicious.
They do. Oh, the gummy industry, yes. And you have to be careful because that has added sugar. So if you're giving them to kids, for example, and they're not brushing their teeth right after or something like this, you could be doing more detriment with those vitamins. So please, emphasizing diet is where you get the vitamins, fresh fruits and vegetables, a lot of color, a lot of variety, and you won't even need to buy any supplements. You'll be saving yourself some money.
And, going into people talk about diets, going on a diet for health reasons, and carbs are brought up a lot. Are these carb-based diets a big deal?
Yes. And it's kind of gone in and out of fad over the last few decades. But, they started out with the Atkins diet that was high protein, low carb. And definitely in the short term, I've seen a lot of people, and I know that it does help people lose weight because when you cut out most carbs that are empty, like rice, potatoes, sugars, these things that you don't actually need excessively, it does help. But don't forget, under that total carbs heading on the nutrition label, fiber is a carb. So if you think about, sugar and fiber being under the same header, well, one's generally good and one's generally bad. I know that you can prevent colon cancer and definitely lose weight and feel better about yourself eating more fiber, but it also is a carb. So you think about fruits and vegetables, they have a lot of carbs, but they have a ton of fiber. And that's the type of carb it is. It's a healthy carb. My mother-in-law, I can contribute to this radio segment, that she taught me this magic that Weight Watchers, I think, teaches, that if you take the total carbs and the added sugar underneath that heading and minus the fiber from it, that would give you a better idea about how many added sugars or carbs are really in the product that are unhealthy, because the fiber is the good part. You take that away from the bad part, and then you're kind of left with the net value.
I never connected that fibers were a carb.
Yes.
So they're definitely not like a bad thing.
No, carbs are so good for you. Please don't take the wives' tale. Don't take what your friend told you. Don't take what somebody on TikTok told you. Fruits and vegetables are never the enemy. I'm not saying to eat a whole watermelon in one sitting, but you can certainly have them. They're very healthy for you.
Okay. Well, so carbs was a definite big topic, and then moving on to more just I guess, bettering your health stuff with protein. Can you have too much of that at some point?
Yes, you can. I told you earlier that you have to be doing exercise to build muscle. So I think a lot of times when the media and marketing is saying more protein is healthier, that's only if you're doing the work to use the protein. Generally for women, we say 45 to 50 grams of protein a day. And men is really only 50 to 55 grams a day. And that's not for people who are athletes. That's a different category. But for your everyday person who has a sedentary job, may walk in the night with the dogs or something like that, you do not need more than that. Any excessive protein will be stored as fat. It goes through the same transformation as the vitamins, for example. If you're using them in excess, it gets stored. Your body doesn't need it. And I do want to emphasize, when we say protein, the most healthful type of protein is plant-based. So nuts, beans, quinoa, lentils, that kind of stuff. And even some vegetables have quite a bit of protein. You have to eat more of them to get the same amount, but broccoli, Brussels sprouts, those type of vegetables have quite a bit of protein as well. So
you can definitely have too much if you're not exercising as well.
Yes, and your kidneys take the burden of that. So if you know anyone who has kidney disease, their doctors would recommend a low protein diet for them. And the kidney acts as a filter. So I think of a sieve you would use in cooking, like if you're straining something. The protein molecules are huge, bulky things, and they can get stuck in the filter of your kidney. So if you have too many of them, it actually is to your detriment in the long term with the kidney function, or if you are under high risk for kidney problems.
I've always heard from a lot of people who do a lot of exercise or weightlifting or anything like that, where they will usually consume protein directly after a workout. Is that a real concept?
Actually, yes. So there are some great studies to do with creatine and different types of amino acids and peptides that go into protein building. And certainly if you're somebody who's breaking down the muscle and building it back up regularly through repetition and a lot of heavy weights and things like this, you do need protein to build back the muscles, because that's mainly what they're made of, is amino acids and proteins. But if you're not using them and working out, good luck. They're going to go to the waistline instead.
So with hydration, That's always a very big topic for me because, when I was a kid, I went through a period where I like never drank water.
Oh, my husband says the same thing.
Yeah. I'm pretty sure I like only drank soda for like a straight year.
No, you're hurting my heart right now.
It was bad. It caught up to me. And I had a moment where I was like, you have to drink. You have to hydrate. And how can you get to that point? A lot of people drink water. And that's, the best source of it, of course. But then a lot of people like can't really drink water. They have to find some other like alternative to it. Is there any true alternative to having a hydration boosting?
Oh, that's a dangerous question. So again, there's a different category for people who are elite athletes and then people who are your regular people who just walk around the block and maybe do some yard work on Saturdays. So when we're talking about the regular person, water is the best drink. I know if you didn't grow up drinking water, it can be kind of boring. It doesn't have sugar, it doesn't have salt, but please remember that is 70% or more of what you're made of is water. So you can have better joint health, you can have better skin, all kinds of things if you just put more water into your diet. Even if it's like you have to pinch your nose and drink it, it really would be to your benefit. And maybe it's kind of an acquired flavor. If you were used to drinking sweet tea and things with a lot of sugar, it's going to taste boring, but the health benefits are there. And the more you drink, I'm sure you'll feel that. But if you're an elite athlete, you can get some benefit from the electrolyte drinks, the Gatorades, the Powerades, these, powders that you put in the drinks. But in general, you have to remember that sodium or salt is also an electrolyte. So I have a lot of younger people who think that they're doing themselves a service by adding electrolytes to their drinks, but it's just super high salt and you can be overdoing it and causing high blood pressure issues, strain on your heart, for example, and even more dehydration sometimes because salt kind of balances out water. So the more salt you have, the less water you have inside of you. So just be super careful. I've seen that a lot in people's labs lately, with this liquid IV and different type of supplement powders. If you take more salt than you're drinking water, you will start to bloat and swell. It will actually keep weight on you. There's a lot of negative side effects of those electrolyte drinks. So if you're using them as a treat or after mowing the grass, with the push mower for a couple hours, fine. But generally water is the key.
Yeah, that definitely makes sense to where unless like you are doing some like high intense activity, you really don't need it.
Correct.
And hydration is important. People honestly, I feel like most issues are solved by just being hydrated. It's just the human nature to want to indulge in something that's a little sweeter.
Absolutely. It's an instinct and a survival mechanism, but now that it's readily available, it's to our detriment.
Before we get to the end of the show right here, there is something that a lot of people are experiencing right now, and I want to ask about resistant weight loss and like what exactly is behind that.
Sure. I get that question a lot. Certainly we can go through diet, exercise, sleep patterns, but a lot of people come in asking me to check their blood work. I have a hormone imbalance. I have a thyroid problem. In 99 out of 100 cases, that is definitely not the answer. It's more to do with their routine, with their diet, with how much sleep they're getting, their stress levels. If you're pumping out stress hormones, adrenaline, cortisol all day, those will hold weight on you. Those are our instinctual stress, fight or flight hormones. And definitely check yourself. If your stress is out of control, there's no way, even with the, new fad weight loss shots or, diet and exercise, that you're going to lose those pounds unless you lose the stress first.
That is right. And something that I've always heard that like it was a kind of a wake-up call for me is how like not getting good sleep can affect your weight as well.
Absolutely. Again, if you're not getting good sleep, your brain's going to send up those stress hormones. It's saying like, I'm so deprived, please. Or if you have ever had the pleasure of working a night shift job like we do in healthcare from time to time, you crave bad things in the middle of the night because you're just trying to stay awake. Or that goes for the daytime too if you're waking up too early. So certainly getting good sleep and asking your doctor or, trying to get a good sleep hygiene schedule would be the first step that I would take for good weight loss.
Oh yeah, and once you start that habit, it will stay.
Absolutely. Your brain loves schedules and routines.
Yes, and so it's definitely not always about eating less and exercising more. It's like truly your lifestyle.
Certainly eating less and exercising more has a lot to do with it, but we can't even get good results for people who are eating the way they should and exercising the way they should if that stress is a barrier. So certainly more important than your diet and exercise to start out.
Well, overall, just thank you so much for being on the show. You taught me a lot, and hopefully people listening can
thanks.
Learn a little bit.
I love it. I love my job every day, and I'm hoping that this is helping somebody.
If you are in need of a primary care provider, you can make an appointment with Dr. Bessom at Hamilton Primary Care at 706-226-9355. Dr. Natalie Bessom is a board-certified family medicine physician, and Hamilton Primary Care is a family practice, which means that they can treat your whole family. Call 706-226-9355 to make an appointment, or visit vitruvianhealth.com/primary for more information.
This program in no way seeks to diagnose or treat illness or to replace professional medical care. Please see your healthcare provider if you have a health problem.
Thank you for listening to Health for Life, a presentation of Vitruvian Health, formerly Hamilton Healthcare System.